Hello, colleagues. Good evening.
Good evening. Good evening, sir.
I hope you're all doing well.
Good evening. We are
Yes, we
fine.
are doing great. Thank you so much. How about you?
Fantastic. Also doing well, by God's grace. And big thanks for making time to join this call. So just a bit of introduction. My name is Joel. I am a pharmacist. I graduated from University of Ghana back in 2015. And after doing different areas of practice, community and hospital, and then eventually marketing for about 5 years, I decided to transition into tech. So, over the past 5 years, I've been building software products as a product manager, with the goal of one, enhancing access to healthcare, that's quality healthcare, and then the other with the goal of enhancing access to um, employability services. And for the purpose of this call, we would be looking at Cordtree. So this is a tool that was built by pharmacists, for pharmacists. So we are a team of pharmacists that's transitioned outside uh, traditional pharmacy practice. So we have lawyers, we have data analysts, we have software engineers, we have product managers like myself. And we decided to come together to solve this problem to the society, which is that for a long time, pharmacists are able to deliver exceptional work when they are in the workplace. However, we hardly do have structured data to speak to it. So you typically see that everyone is creating some level of impact in their pharmacies. Some of these are jotted on Excel spreadsheets, some are stored mentally, others are stored in, notebooks and what have you. But then there isn't a universal way to really standardize and structure all these things that are being done in order to um, collectively analyze the kind of impact that you are making. So this project that is organized by GCC, I mean, sponsored by GCC and led by PSGH, gives us the invaluable opportunity to be able to produce such data and then leverage such data to drive decision making. So imagine 2 years from now, we are running some engagement with the Ministry of Health, and we are telling them that, hey, pharmacists are integral to the healthcare system, especially when it comes to the most vulnerable, which is mothers and children. And this is the kind of impact that we've delivered over the past couple of months through this project. And if it is something that is scaled across the country, would see that yes, pharmacy is truly a primary healthcare system. So that snowballs into a lot of things like the fee for service, extra income stream for pharmacists and whatnot. But it always has to start from a point. And I'm excited that we are the very gallant people that chose to start the journey, where we get to show our other colleagues that this is possible. It is possible to document cases that come to your facility. It is possible to share this information, like aggregate this information, and then share it with policy partners, stakeholders, just so we can scale up that across the country and deliver the best of care to our patients. So, on that note, I would say that I'm really excited that we get to talk about Cordtree. which is a documentation platform for pharmacists. Cordtree is basically a record tree, so we took out the RE. So think of it as you're able to create a lot of records on your patients and you're able to manage them much more effectively and seamlessly. Not only that, you're able to also help with being able to aggregate this for analysis, just so that anonymized data can be used to drive important decision that affects our profession. So that's just a bit of a background, and in this lesson, you will learn how to use the Cordtree platform and the various steps it takes to be able to add a patient, add a visit to your facility, add interventions that you would be making, um, add follow-up notes and follow-ups that you'd be making as well. And if you do have any question, you can ask at any point in time. Before I move ahead, I'd like to pause here to see if you have any questions, whether you are clear on what we are going to do. And I mean, of course, if you have any questions, happy to address those questions. Any questions? Okay, so are there any questions?
So no questions from my end.
Okay. Then I think I'll just jump in. So one very, very important part of this entire process is that you have to create an account. If you want to have access to Cordtree, the most important thing is to create an account. So I also have my colleague Nanisi on the call who would be assisting me with any comments in the chat section. But to start with, I'm just going to share a link to the platform that everyone can click on and you can sign up. Now, there are two ways that you can sign up. You can either sign up with email or you can continue with Google. I always advise people to continue with Google because it is safe, it is fast, it is very streamlined. So typically when you click continue with Google, you would have a form pop up. Let me So because we are running training, I'm using the a replica of the platform, not the actual platform, so that it does not pollute the data that we have on the main platform. So when I click sign in with Google, I can sign in with my regular Google account and then it's going to work. So I'll click on joelanaman@gmail.com and then because I've already signed up, I wouldn't go through the sign up process. Typically, you would go through a sign up process where you provide your name, you provide your, your PIN, your professional status, and whatnot. You get to go through that entire end-to-end process so that when that detail is captured, what's going to happen is that anytime you record data when you log in, that data is captured under your name. So you don't always have to be recording your name for every data that you've captured. That data is automatically captured under your name. So that's the very, very first aspect. The very first aspect is to go through the sign up process. You go with Google and then you provide your details, first of all, your personal details, your location, your name, your first name, your last name, your location, your phone number, your WhatsApp. Then you get to provide your professional information. So where you're working, in case you have a PIN, you indicate a PIN and all of that stuff. You capture that too as well. So when you're done with the sign up process, you would come to this page that allows you to add your very first visit. And how we define these terms is based on like how the pharmacy would run. So um, we have visits, which is a case where someone walks into the pharmacy and engages you as a community pharmacy practitioner or professional. That is termed as a visit. So if I come in the morning, I come and complain about headache, and then I come in the evening, I come and complain about stomach pain. They are both visits, but then it is for that same patient. And that takes me to the next step, which is patients, pretty much straightforward. Patients are people that you serve in the community pharmacy when they come to you for care, whether they are coming to just do their blood pressure screening or they are really coming to present some complaints to you, which would result in you giving them some medications. So that is patients. Then we have interventions. So interventions are the things, the actions that you take as a community pharmacy professional that helps to broaden the quality of service that you're delivering to a patient. So, for example, a patient comes to you and tells you that they're having a headache, then you go, the long mile to really check their temperature, screen for malaria, all those things. And eventually you realize that they have the parasites, and then you go ahead and treat. That is an intervention because if you did not intervene on behalf of the patient, something could have gone wrong. So that third part is interventions. There, all the amazing initiatives. It happens naturally, right? But when it comes to documentation, you realize that it's actually quite deeper than you think when you do something as basic as giving someone a malaria treatment. You go through an entire process, and you can actually document that entire process for on that particular patient. Just so 3 months later, 4 months later, even if they come to your facility, you're able to find them and then you're able to still continue building their records. And that's why we call it Cordtree because you're building a tree of records. Then finally, the follow-ups. So follow-ups are basically plans that you set to follow up with patients. Um, the facility can get very busy. So imagine you have about 10 patients that you have to follow up on. Sometimes you write this on paper or we write it in books and whatnot. But this gives us the opportunity to actually document it as okay, I want to do a follow-up on this patient. This is when I want to do the follow-up, etc. And you're able to add a note, a follow-up note, when you are engaging the patient. So that's just a broad overview. And this is a dashboard that shows you how many things you've done so far. But I'm going to walk us through um, a particular visit, right? So if a patient comes into the facility and want to document that experience, what would that look like? But to make it very practical, this is what I'll do. I want to pick anybody or I want someone to volunteer on the call and then have the person walk me through the last patient that came into their facility that they took care
Ay,
of.
mamá,
So
I'm
that,
gonna spend 500.
hello, Charlotte, I
And
think you are,
I just know.
can you mute yourself, please? Hello, Charlotte. Can you please mute yourself?
You
Okay.
come me stranger never present or logo.
Hello, Ari. Are you able to mute
Yeah, yeah,
Charlotte,
let me do that.
please? Okay. So what I was saying is that I would want to make this very, very practical, right? Instead of using a hypothetical case, I would want to use a situation. So, like an intervention that any of you have done quite recently. It can be as recent as today. It could be that the patient walked in to just take their BP and left. It could also be that the patient walked in and you delivered a comprehensive care. I want to use a case from one of us so that when I document this, it will be very clear to you. So, does anybody want to volunteer? Any volunteer in the house? Or probably I could recommend people. So Pakwesi Asante Opokunkum.
Yeah, can you recommend somebody else? Bakusi is our finance manager. He's not a practitioner.
Maybe the spirit is telling me that he has to start practicing. Okay,
I
okay,
will
so
start very soon.
maybe so. Dr. Edmond,
Hello. Yes,
hi.
boss.
Dr. Edmond Nelek, thanks so much for agreeing and unmuting yourself. So I want to demonstrate how you can document a visit on Cordtree, but I want to use a very practical scenario. So are you able to walk me through one interesting visit? It does not necessarily have to be interesting. One visit that you've encountered today, right? So that we walk through the entire process end to end.
Uh, that's a difficult one. Let me take the next one.
Oh, I just want to see today. Have you seen a patient? I think probably that's where I want to start from. Today, have you seen a patient? Hello, Dr. Narek. I can't seem to hear you.
Um,
Harry, are you able to hear Dr. Edmond
yes,
Nelek?
I can hear you. I
Oh,
can
okay,
hear
okay,
you.
okay, great, great. Great. Fantastic. So I was asking that today, have you seen a patient?
Not
It
yet.
does.
I actually in the evening.
Okay,
I
you are in
haven't
the
seen
evening. Okay,
it.
okay, okay, okay. Okay, then let me move to Benis, because I want to make it very, very practical. And it can be as basic as the person walked in and came to check their BP. Like it can be as basic as that, right? All those scenarios exist, and we're able to accommodate that in the tool to streamline your workflow and bring a layer of professional duty to the work that you do as well. So, Benis, are you able to speak? Or Enyunam, please don't break my heart. Oh.
About this, just this evening,
Yeah,
someone
Benes.
was the BP.
Hello, Benes. I can
Yeah, you know.
I can hear you, but the voice is a bit masked. So if you could adjust that for me, please.
Hello.
Fantastic. I can hear you crystal clear.
So I'm talking about the checking of the BP. So there's this old man who came in this evening at around 3
Okay.
this evening.
Okay.
So when after checking the BP, it was high. So it
Okay.
was 153 over 87, if I can remember. So
Okay.
what I
So
I
Benes,
gave him,
Benes, I would
yeah,
want us I would want us to do it step by step, right? So that we see how that will typically look like on the platform. So whatever you are giving me, whatever information you're giving me, I'm going to replicate that on the platform so that it becomes very practical to everyone. I hope you get me.
okay, okay,
Great. So with Bennett's case, an old man walked into the pharmacy. So the very first thing that you want to do, that's a visit, right? So the very first thing that you want to do is to click add new and click visit. And you can do this on mobile as well. The way we built this platform was that even if your screen is small and you want to work with mobile, like on mobile phone, you can still do that. This is how it's going to look like on mobile. This is literally how it looks like. So on mobile, you would see this plus sign, and then you click visit. And I would want to even use the mobile to demonstrate because that is maybe the device that most of us will be using, right, for flexibility and all of that. So when I click visit, it takes me to a page, right? A page where the first thing is telling me is to select a patient to create a visit for. Now, always note that you can't create a visit without a patient. Like visits are for patients. So before you go ahead and create a visit, you always have to create a patient. But we also understand how busy the pharmacy can get. And also in a physical of that you to name. Hello, Bernice, you're on mute in case you're speaking. I want to find out if you remember the name of the old man.
Oh,
Hello?
oh no, I didn't capture the name. He's hello.
Yeah. Bernice.
I don't know
You
his
said
name.
you
I didn't capture his name. We only
exactly. hmm
checked
The only
the
details you
BP. We
captured is
only
the clinical
monitor
stuff.
for him.
Okay, sure. Okay, so that becomes like
He's a regular customer.
regular customer, exactly. So what you can do is that instead of adding him as an anonymous patient, so typically you can add someone as an anonymous patient, but anonymous patient means that the person you don't like the person is never going to come back, but this person is a regular customer who you know is going to come back. So you can create a name for him, and then you can later edit out that name. So the reason for this is that when you create the patient's name, you are able to build the record on that patient over and over again, similar to what we experience when we go to the hospital, where they tell us, hey, where you card, or do you have a card, and all of that. The whole idea is that when you go, your medical records are compiled under one particular folder over and over again. And it's the same thing that is happening here, nothing new. So in this case, we would want to use the old man's name, right? But we don't know the old man's name, but we know that he's a customer. So he will definitely come back and record his BP. And it's important to record all those BP in succession. So the first thing that we are going to do is that we are going to click here to add a new patient, right? And when we see here, click here to add a new patient. For the purpose of the demonstration, we can use the name old man, right, as the first name and the last name. But ideally, you are supposed to capture this detail. And the best part is that the next time he comes into the facility, you'll be able to edit these details to suit his real name, what his real first name is, and what his real last name is. So that is one. Then the next thing is that you have to indicate the sex, so whether they are male or female. In this case, the person is male, so we are going with male. That is one. Then the next thing is if they have a phone number. So number is one of the ways that we use to identify our patients, right? So you know very well that everyone has a distinct phone number. So at worst, that can serve as a form of identification. And on top of that too, if you take the phone number, you can always call them to reach out to find out any information that you want to find out. But also, in a case where the patient does not have a phone number, then you'd want to toggle this button that says patient's phone number unavailable. So by toggling this, you are basically saying that the patient's phone number is not available. So they should use yours as the practitioner. You should be able to use yours. And I just want to prompt Nancy here that she should be taking note of some of the experiences that could be improved on the platform so that we can share with our software engineers. But yes, patient phone number is unavailable, so you should use yours. And you can now put in your phone number, maybe 0240 000 123. So basically, even if the patient's phone number is not available, although it's part of the mandatory information, you can use your phone number because there are cases where patients may not have a phone. And then you click next. Upon clicking next, it will take you to additional information. So this additional information is any other information that you can gather from the patient. I would say the most important one is the date of birth. The most important one is the date of birth. So typically, you want to know the age of the patient, and you can ask them, okay, how old are you? So based on the age, you can now calculate the date of birth. So maybe if they say they are 40 years, then it typically means that they were born in 1985. So you can select 1985 for the year. And then if you don't even have the month and the day, you can choose January 1st. So it's like the first day of the year, right? You can assume with that. But the most important thing is that the year of birth is captured, which is 1985. Now, when you're done with this, you don't need to fill out all this detail because the patient is with you and you're trying to clock them. So the next thing that you want to do is to hit next. And then when you go to the next page, we allow you to select the websites that you are using to capture this information on the patient. So, like you can see here, there's Nature from Addis, which is a facility that I listed when I was creating my account. So, when you're creating your account, you get to list your places of work. And we know that as healthcare practitioners, locum is not anything new, right? So, all the places that you practice, you'd want to capture the detail in here so that when you are sort of capturing the data, you want to also label the data to the facility that you are working in at any point in time. So what we have here is you confirming the website that, okay, I'm gathering this data from, say, Nature from Addis. So when I confirm that and I click next, I get to a point where I'm able to provide clinical information. So, Benes, this is where it becomes important to collect the data on the vitals. You mentioned that you took the patient's BP, right?
Yeah. Hello.
Hello, Benis. Yeah.
Yeah. So 153.87.
Okay, I think Joel's network probably went off, so I think he would join again soon.
Hello.
Hello, please can you hear me?
Yeah, I can hear you.
Yes,
Yeah, I'm saying that I think Joel's network went off, but I'm sure he will join shortly. So maybe we can wait for him to rejoin. Then maybe he can continue with the illustration.
Okay. Hi, can you hear me?
Yes, we can hear you. Welcome back.
Okay, I think my network dropped. Apologies
Yeah.
about that. It's rained a bit over here, so it's understandable. So, kindly confirm if you can see my screen.
Yes, we can see.
Okay, fantastic. So, like I was saying, I'm intentionally using this mode to show how you'll be seeing it on mobile because I'm sure most of us even joined this meeting on our mobile phones. So how to get that level of flexibility? So Benes, like you mentioned, you took the patient's blood pressure, right? The old man's blood pressure. So you can ignore the signs and symptoms, the vitals, laboratory investigations, past medical history, medication history, and focus on the vitals itself because that's where you take the blood pressure, the pulse, and all of that. So when I click on vitals, right? When I click on vitals, here we are with the various information. So pulse, blood glucose, respiratory rate, SpO2 temperature, all the vital labs that we know or vital signs that we know. So, Benes, I want to ask you, you mentioned that the blood pressure, where does the like apart from the blood pressure, are there any other things that you recorded? And of course, we'll look at how we can record the blood pressure. So can you walk through that part of the process? Hello, Benis, are you speaking? Hello, Benis. I think you're on mute. So in case you're speaking, we can't hear you. Um, but while we are waiting on Benis,
Yeah.
okay. Hi, Benis.
So I would like we should know happened.
Hello, Benis.
And this is a teamwork.
Whilst we are waiting on Benis, I just want to find out if whatever we've done so far is very clear. So wanting to create a visit, adding a patient, adding the first name, last name, their phone number, even if you don't have that, adding their date of birth where necessary, and selecting a website, and then finally coming to the vitals. Because we are going through the training process, it looks quite long, but that's something that you can typically complete in, say, a minute or 1.5 minutes if you have all the information that is needed. So I want to find out if,
Hello.
hi, Dennis. Menace, I can hear you when you unmute. So can you unmute yourself and speak then? Whilst you are waiting for Benes, I would want to know if you have any questions. So it can be questions, it can be a reflection, right?
Please,
That come again. So it can be questions, it can be submissions, it can be reflections, more like, oh, this is interesting. I now know how I want to capture this information, or I didn't know that I could ever capture all this information. So this is something that I think would help my practice. So I'm happy to also listen to any feedback that you may have whilst you're waiting for Benes. Benes, can you hear us? I see that you've unmuted yourself. Hello, Benes, can you hear me? I think we are losing Benes. So I quite remember that Benes mentioned that the blood pressure was 150/93. So what I'm going to do is that I'm going to put
This is an
that value
amount of
here
money that
as
we save.
150/93. Okay. And let's assume that yes, when the old man came, we not only take the blood pressure, but we also took the pulse. right? Where the pulse is probably 110. So has a high pulse, has high systolic blood pressure, as well as diastolic blood pressure and all of that. So let's say that's the only information that Bernice took and then saved. Bernice, of course, if you get the chance to um, speak, please unmute yourself and speak. But I'll go with a bit of assumptions here. Now, we know that the patient's blood pressure is quite high, right? So we can proceed to add an intervention. Okay. On the other hand, we can just say that, okay, we are done. So the patient just came to check their blood pressure and that is it. We are done with it. And that's typically a case where the blood pressure is looking good. There's nothing really you can, counsel the patient on and all of that. But then you can proceed to add an intervention, especially for such a case, right? So when you click on proceed to add an intervention, we show you this page where you can actually add a new intervention. So you can see here the various aspects. You can add a new therapy, you can discontinue a medication, you can adjust dose, frequency, or duration of a particular drug, you can switch a particular medicine, you can counsel a patient, you can source medicine for a patient. So all these things, you realize that these are things that we do on a day-to-day basis when we are in the community pharmacy. It's either we are initiating some form of therapy or we are serving a prescription, or someone comes and they tell you that they are taking a medicine and they are not supposed to take that medicine. So we tell them that, hey, discontinue the medicine. Or someone comes and they are taking a medication and they are overdosing, not only because of probably the dose, but also they are taking it much more frequent than they should, or they've taken it for a prolonged period that they should. So that is also an intervention, or a case where you want to switch a patient to a much more effective medicine. So you initiate a switch, or a case where you just counsel the patient. So for this particular situation, you realize that the actions that we took, we are going to assume, and Dennis, if you're able to unmute yourself and speak, you can speak. But then the action that we took was counseling. So we are going to counsel the patients, right? Now we've broken down this into like straight workflows so that you don't have to be doing a lot of typing. So by clicking counseling, right, it is asking me for the care issues. It's asking me for the details of the care issues. It's asking me for the patient's condition, medications, if any, counseling notes and whatnot. So my care issue here is that maybe there's some form of ineffective treatment, the drug therapy is not required, safety or ADR issues, or adherence or medication access issues. And in this case, we can clearly say that possibly the patient does not have access to the medicine or they are not adherent, right? Because their BP is high. So they are probably taking treatment, but maybe it's not working. Or they don't take any treatment at all. So again, I'm going to roll with the assumption that the patient has an issue with adherence, right? They are on a particular medication, but it is more about them and it's not about the efficacy of the medication that they are looking at. So when I choose adherence, I can provide several details, right? So what are the reasons, right? So you can see here, inappropriate dosage form, patient cannot swallow, forgetfulness, the treatment is complex, medicine is unavailable, the medicine is expensive, the medicine worsens other medical conditions, so they don't want to take it. There's undesirable side effects, there's little understanding of the disease condition. So all these things are reason for which someone can say, you know what, I'm not going to take my medicine, and they are very valid. So we give you the opportunity to select as many as possible. So maybe their religion is interfering with they taking their medication. Maybe they have little understanding of the therapy or the disease itself, that okay, hypertension can basically kill you, right? They don't know that. They just know that okay, I just come and check my blood pressure and go. Maybe too, there's a bit of forgetfulness in there. So you can select as many details as you can over here, right? Which is the details of the care issue. And of course, you can also take out some of the items if it is not necessary, if um, it does not apply to the patient. Now, you would also have to add the patient condition. So in this case, you are looking at a patient who has hypertension, right? and we are saving that. So over here, we are seeing that, okay, there's a care issue around adherence, medication access. We are also seeing that the reason or the details for those adherence issues that the person has religious beliefs that are interfering with their therapy. They don't have an understanding of the therapy or disease. They forget about the therapy. So all these are things that you would have synthesized from having conversations with them. So you have the conversations with them and you realize that, okay, I need to, document these aspects. So after adding the patient's condition, say hypertension, we can now come here as counseling notes, right? So we get to provide all the necessary information. So, for example, we get to say that patient was counseled to reduce salt.
I think his network is gone off again. Oh, for sure. But he'll join soon. Please, if you have any questions so far, or any concerns, or any suggestions, we are open to receiving it from everything that he has said so far.
Okay. My network keeps
Okay,
dropping
we'll
and
come back.
then I need to keep coming back. Thanks for the third welcome back. So, I'm writing here that patient was counseled to reduce salt intake. Patient was educated about hypertension as a disease condition and how they have to exercise 3 times a day, right? And so on and so forth. So all the counseling information that you would have added all of that here, right? And maybe patient was advised to visit the hospital. So after putting in these details, you get to rank the clinical significance of your intervention. So maybe on a scale of 1 to 10, you think, I mean, it was quite high, so the intervention is 9, or it was 8, or it was 10. You get to choose. That's very subjective and it's really dependent on your practice. But then when you go through this, you hit save, and that information is captured on this particular patient. So we can say for a fact that for this patient, they have adherence or medication access issues, and then your intervention has been to counsel them. If you need to add a new therapy, if you need to adjust something, discontinue something, you can add as many interventions as possible that applies to the patient. So by going through this step, you can now save the intervention. Benis, I don't know if you are still with me, but I'm running with a lot of assumptions. So we captured the high blood pressure. We said that, okay, this patient has adherence issues. So we've documented interventions for that particular patient. And we are taking things to the next level. So now you can decide to say, okay, you are done. But remember, this patient is quite delicate, very, very delicate because their blood pressure is high, they are old. You've told them to go to the hospital. You want to make sure that they really went to the hospital. So for this patient, you can go ahead and create a follow-up plan. So it is typical, like what you experience in the hospital where everything feels very structured and all of that. That's the same way we would want to document the cases that we see in the community pharmacy. So you can go ahead and create a follow-up plan. And by clicking create a follow-up plan, similar to what you did with the intervention, you click here to add new plan. So you can decide to follow up on a specific day, or you can decide to have a recurring schedule for the follow months or every 3 months with a patient. You can do that. Or you want to follow up on a specific day, you can do that. So let's say this time we want the patient to we want to follow up with the patient because we want to make sure whether they went to the hospital. So we are going to say that we are going to have a specific day for the follow-up. Sorry, we're going to have a specific day for the follow-up, and we'll indicate in how many days do we want to contact the patient. So maybe you want to contact the patient in 3 days because we want to give them time. right? We want to give them time to really go to the hospital. So contact patients in 3 days. We indicate the reason for follow-up. So whether we are tracking therapeutic outcome, we are monitoring health status, we are collecting feedback on referral, all of that, right? We can put all of those things here. So in this case, we can say we are collecting feedback on referral, right? And then we can say that this patient should provide uh, me with details about their visit to the hospital. So when you are done with that, you can literally click save, right? And then it gets saved. So you can see here saying that you need to check up on old man in 3 days' time, right? And the status is pending. So it is showing that you need to check in on old man in 3 days' time. So it's now up to you to always like come check the follow-up step. In the future, we are going to introduce reminders where we would send you a reminder and say, hey, you have a follow-up to make because you said you're going to check on this patient on this day, blah, blah, blah. So we'll send you that information to you. Now, you would see that under the follow-ups panel, and then you can actually add a follow-up note. So on PC, it is going to give you these full details where you can see the visit, right? So when I go to see visit, you can see here that I have the vitals, I have the labs, because this person is male, they are not pregnant, they don't have any pregnancy of the sort. I have the past medical history, which is that they are hypertensive, no indication, no information on past medication. We didn't indicate any signs and symptoms. Of course, we made an intervention. And the intervention was that we saw that the patient had adherence issues, and these were the reasons why they had adherence issues. Their disease condition was hypertension, and the counseling note is captured here. So everything that you documented in that visit, you can always revisit it. Just so when you are talking to the patient, you are very, very sure that whatever discussions you're having with them are truly discussions that you had the previous time and it's a continuation of things. And that elevates the quality of care that we are giving to the patient. So under the follow-ups, you can add a follow-up note by clicking these three dots. You can add a follow-up note, right? And then the follow-up note allows you to put a comment on here. So, okay, collect feedback on referral. What happened from the referral? It could be that okay, they were put on a new medication. So patient was put on a new medication. Maybe lisinopril 10 milligram. So you can save that information as well. And you see that this moves from pending to completed. It moves from pending to completed. You can also, if you're on phone, you can click this button and it will automatically call. If you save the patient's contact, by clicking that button, it will automatically call the patient for you, and then you can have the conversation with the patient. And then finally, of course, if you want to delete the follow-up, you can delete the follow-up. You can also edit the follow-up plan. You can view the follow-up notes. You can add a follow-up note as well. So viewing the follow-up note, this is how it looks like. If you gather any extra information, you can click on edit follow-up notes and then provide all the necessary details that you need to provide. Additionally, you can decide to record a new intervention. Sorry, I'm having some allergic reaction. You can decide to record a new intervention, but that's a new flow that we are yet to introduce where you can record a new intervention from here. So that captures end to end the situation of recording a visit. Let me reload this to the home page. Okay. That helps us to see. So that's the end-to-end process of going through a visit, adding a patient, and all of that. And this is where it becomes very interesting, right? you see under your patient, you can always come and see old man. The old man is still captured there. Like you have the old man's details. And you can always like edit the information. You can edit the name, like I mentioned. You can change it to the real name of the person, especially if they are a recurring customer. You can also go into the patient's details, and under the patient, you can view all the visits. So, assuming that the old man came to do BP reading, they came to do something else, you can view all the visits here, and that's what Cordtree is about because you'd have full overview about the care that you're delivering to a specific patient. And it is even much more important, especially when it comes to antenatal care, right? Or postnatal care for mothers and children when it comes to you being able to have follow-ups, you being able to engage them and all of that, you can still record all those details in Cordtree. And this brings, a lot of professionalism to the practice. That is one. Secondly, two, because everyone is using the system, we can now analyze the data in the back end, connect it together, and then run reports to drive policy initiatives. And that is one of the ways that we can improve the profession for ourselves, right? The healthcare profession for ourselves. So I would pause here and see if you have any questions. I think I've spoken at length. So I'll pause here to see if you do have any questions, and then I would answer them. So you can see your visit, you can see your intervention. So you can see here for old man, I did counseling, adherence, or medication access issues. For John Doe, I initiated a new therapy, and I can view all these. I can view all this and see, okay, what are the impact that I'm making in the lives of my patients? And of course, because of the delicate nature of our work, if um, it happens that we have a lot of information that we have to share, like assuming there's something that comes out, the patient says they came to take something from a particular um, medication from us, we can always come here and show whether they really took medications from us, right? And if they took medications from us, what was the nature of the medication? What was the counseling point? All that information is something that you can always revisit. So I'll pause here to take any questions that you may have or comments, right? It does not have to be questions, but comments. It could be a reflection where you say, "Oh, this might benefit my practice," or "Oh, this is too much. I can't do it for my practice." Like it would be great to hear your feedback, and also take any questions that you may have. But Elvis, do you have any submissions for us? Hello, Elvis, or any other person. Benis, at least we're using your case to drive the conversation. I hope you can hear me. Can everyone hear me?
Yeah,
Vanessa, can you hear me?
yeah, I can hear you.
Yes, you can hear clearly.
Okay. Okay. So, Dr. Nelik, Benis,
Okay.
I'd really want to find out how this sounds for you.
Yeah, I think, in fact, if you have called me now, I could explain better. It's very good. At least keeping the records of clients, especially those who will continuously come. Then at any given time, you can be able to talk about the interventions that are implemented on them. So it is good. It's nice.
Yeah, Dr. Nelik, and I hope to be we'll be on a platform, and AC and I will be on a platform to be providing full support to you. So when you encounter any challenge, maybe you're signing up, you don't know what to do, all of that, please reach out to us and we'll provide you with the necessary guidance. Um, I know, Elvis, you've been attentive throughout, so I'd love to hear your feedback, comments, or questions about the platform as well. I think you're back online. Hello, Elvis, can you hear me? I'm not sure if Elvis can hear me. I think you're mute. Your mic is muted. We've lost Elvis. Okay, Benes, I'd love to hear from you based on this being a case for you. I'd love to hear from you whether you think this could be a game changer to your practice. Hello.
Hello. Hello.
Hi, Benes.
I didn't quite get you.
No, so I was asking that based on the flow, right, what we went through, because it was on your case, what's also your own feedback and your own reflection? And do you understand everything clearly and all of that? I just wanted to take some feedback. And of course, if you do have any questions as well, happy to answer those questions.
Uh, okay, so about the initiation is very good, but what I want to ask is, what if I advise him to come the following morning for another checkup? Am I going to still
I think I'm losing you. You said you asked him
with
to come
different
this
dates,
morning.
or
Benes, Benes, I'm losing you. I don't know if it's just from my end.
if like, hello,
Yes, Benes, can you hear me?
I'm saying like if I give him time, I gave him time to come and check the BP again after my intervention.
Uh-huh.
So I don't know
Uh-huh.
if he comes later on, still the same day. Will I still record
Yes.
his details under today's
Mm-hmm.
date?
That's going to be a new visit, right? When he comes again, that is going to
Yeah,
be a new visit. And this is how typically you would have recorded that. So same thing, you are going to add a new visit, or if it's showing like mobile-like view, right? You would click here, you add a visit, and then this time round, because you've already added his name, you don't have to add the patient again. So you see how efficient it gets. You just have to select old man. You go to next. Maybe he comes to check his blood pressure again, right? And now the blood pressure is 130, 70, right? You can save that. And of course, if you don't have any other interventions to make, you can just click done for now. And then when you click done for now, you would see that over here, the visits, we have the timestamp 21st May 2025 at 5:51 p.m. Then we have 21st May 2025 at 6:22 p.m. So each of this has its own details, right? All of these are individual visits that you can always come and run updates on. And also when you go to intervention, you realize that you'd only have interventions for the counseling because this one, after you check the blood pressure, you didn't do any intervention, you didn't counsel, you didn't do anything. So it is just the previous one that is showing over here, right, as the intervention. So that is how you can record a follow-up visit when the person comes to the facility again. I hope that works. The explanation is clear. Bennett.
Yeah. Thank you.
Fantastic. So while we wrap up, I would want to encourage all of us to create our accounts on here. I shared the link earlier, but I'm sharing it again. Please, and everyone, please create your account. If you have a Gmail, a Google account, it is very easy to go through a process, but you can also sign up via your email. And then you add your details, you go through the onboarding, and then you complete it. Then you can record your very first visit. And we are here to support you every step of the way. Um, you'll be one of the very first people to have access to this tool. You are also pioneers of this level of change because 3 years later, 5 years later, I mean, that's how systemic change happens. But 3 years later, 5 years later, when we start talking about how community pharmacists or community pharmacies are seen as a center for primary healthcare delivery with different types of healthcare practitioners, whether it's pharmacists, it's dispensing technicians or pharmacy technicians, it's nurses, whichever profession it is, will be able to show the world that, or even the country, that we pioneered this, we made it possible, we made other people believe that this is something that we can do as part of our practice. So thank you all for the time and attention, and I hope we get to engage more on the WhatsApp platform. Harry, over to you.
All right. Thank you very much, from Joel, for taking us through this. And I think I just want to add my voice that we should please create our account. And once you have your account, you can start to document the interventions as far as this project is concerned. The training that we did last month on the services that we provide. And the catch here is that at the end of the month, we are going to collate all the input. We're going to vet them. We are going to do some quality control here and there. I mean, we will randomly call a few of the people that the visits or the clients that you add. Once everything is verified, we are going to receive a fee for the service. So please, every service at all, every kind of intervention at all that we provide for young women or women of reproductive age, pregnant women, and even children, it's important that we document this. And we also need to show the policymakers, the ministry, and the Ghana Health Service that yes, with the right structures in place, community pharmacy personnel and community pharmacy can contribute more to primary health care. So please, these two motivations should guide us so that we can really show the data to them that once the right structures are in place, we can really contribute more to primary health care. So thank you so much. This session will be repeated at 10 a.m. tomorrow, God willing. So the other people who couldn't join today can join. But if you also want to join again to get better understanding, you can join again as well. And we also share recording on the platforms for you to take a second look at it in case you want any clarifications. But please, let's create our accounts. That is very crucial for us. Thank you so much. All right, Joel,
Thank you very
over.
much, Deputy. Yes. So I hope to catch you all on the call. I mean, on the WhatsApp page. Sorry, not a call. I'll catch you all on the WhatsApp page. So looking forward to that. The link
Joel,
is
please share
shared.
the link on
Oh,
the WhatsApp
no,
platform as well.
yeah, on the